Thank you, Nancy. Thank you for the introduction. Thank you, Gateway, for having me here today to speak about physiotherapy. As Nancy said, I'm a physiotherapist working in Goderich in a private physiotherapy clinic. And I've got lots of pictures to go along with these slides to keep people's attention. There's a beautiful picture of our Goderich Harbor. So this is a picture of the clinic that I work in. It's a facility right in Goderich. We have 6 treatment rooms, a gym for people to work out in, and a waiting area. I've got a few pictures just to show you. You can see our front desk area with Kristen having a big smile. Walter, our skeleton, is always there to say hi when you first come in. Treatment rooms all pretty much look the same, and the gymnasium where people work out, although nobody looks like they're working very hard in that picture. Our staff consists of 5 physiotherapists, and there's a group of pictures. So we have pretty much everybody that works at the clinic in at least one of these pictures. So myself, Milena, Tim, Megan, and Val are physiotherapists that work with us here. We're lucky to have 2 physiotherapy assistants, Kristen and Abby. And we also have Jordan, who is a kinesiology graduate and is our tech wizard, as well as wizards in many other ways. And then Joy Miller is also an assistant at the clinic here. We're lucky at the clinic to mentor a variety of different students. So we do welcome students from Western doing their placement, which is usually a 7-week placement. They're physiotherapy students. We also do placements for physiotherapy assistant students as well. So from Lambton, Fanshawe, Mohawk College. And we also work with the local high schools doing co-ops for their students. And right now, this is Graham. He's with us right now for this semester. He's a great young guy, lovely to have around. So you may ask yourself, well, what is physiotherapy? Physiotherapy is a regulated healthcare profession. We're evidence-based. It's a university degree. So you've gone to school for an undergraduate degree, and then it's a post-grad education. And our goal really is to restore and maintain function. So trying to promote people's mobility and help with their independence as we all go through life. We try to maintain your independence by the use of movement and exercise. So who do we see in the clinic? Well, we see a variety of different conditions, and I've listed a number here. Orthopedic conditions, so that would mean muscle, bone, joint, ligament injuries. Concussions, so concussion rehab, whether it's sport, work-related, or you just fell at home and hit your head. Vestibular, so inner ear issues, as well as dizziness problems. Neurological disorders, so that could be something like Parkinson's disease or multiple sclerosis. Sports injuries, if you fell off your horse, running injury, anything to do with sport, we'll see. We also see surgical patients, so we'll see people before they have surgery to get them ready. We'll also see them post-surgical as well. We do the GLAD and BoneFit programs here. So GLAD is an arthritis program, an osteoarthritis program. It's a 6-week exercise program for people that have arthritis in their knees and their hips. BoneFit is an exercise program for people with osteoporosis. And other arthritises like rheumatoid arthritis, we also will treat at the clinic. So it's a big variety, it's a big scope of practice. What will happen at your first appointment? So you'll come in, you'll be introduced to your physiotherapist, you'll be taken into a room, and we initially talk to you. So we get to know you, find out about who you are, what your injury is, what your likes and dislikes are, what your goals are. And then we'll assess you. So we'll do a physical exam, find out what the injury is, talk to you about what we think is happening and where we see your treatment going, and trying to determine your goals and how they're going to meet with what we feel your treatment and your outcome will be. And our goal is always really to try to get people back to doing what they're in what they really do enjoy doing. So treatment can mean a lot of things when it comes to physiotherapy, and I've listed a lot of things here. Can be manual therapy, can be exercise therapy, can be the use of modalities. We also do return to work programs or functional rehab. Taping can be part of that treatment. Gym sessions, education is always part of what we do pretty much every time we see somebody. The GLAD or the Bone Fit programs, and we also do deep needling and acupuncture. So what is manual therapy? Well, manual therapy is a hands-on treatment. So usually it can be a mobilization of joints throughout the body or a manipulation of different joints in your body. Here we have a picture of Milena doing some traction on Janet's neck. She did not pull her head off, which was a big relief during the filming of this. We also do muscle releases. So that's using our hands to release the muscles that are tight or having some kind of issue around that area that we're working on. Exercise therapy is a big part of physiotherapy. So it can be either in the gym or in the room. Usually there's some kind of home exercise program that takes place as well. It may not be strengthening exercises, it could be mobilization, so trying to keep an area moving and an area lubricated. So we have a picture of Abby and Val and Graham down at the bottom, and then there's Tim watching his client do some work in the gym. Taping can also be part of the therapy session. Sometimes people are just coming in to get taped. Sometimes it's part of the actual assessment or follow-up treatment that we're doing in the clinic itself. This is an ankle sprain, and it's being taped in order for her to get through her day. My son said to tell you all that taping is a really good way to, get your hair removed from your leg. Modalities, so we have a bunch of different modalities that we can use depending on what the injury is. Ultrasound machine, an interferential current, muscle stimulation, and we also use hot wax, especially on the hands. So an ultrasound machine can be used when there's swelling, if there's pain, if you're trying to get an area moving, so we can actually use it to heat up an area. Interferential current is used for pain control, and you can see this on the lady's back in that third picture at the bottom. She's having the interferential put on to help with back pain. Jordan, with his great pumpkin hat, is having a muscle stimulator put on his thigh by Milena. So the muscle stimulator helps a muscle to contract if there's some weakness there or it's post-surgery. Education, as I said, is really always part of what we do, whether it's educating the client on why we're doing the exercises, why they're having pain, why there's stiffness, why we foresee them taking this long to heal. We also will talk to them about any x-rays or reports that are coming in from their family doctor if they don't understand. Return to work program, that usually is with WSIB. So a work hardening program can also be with WSIB or a motor vehicle accident. And that usually entails, 2 or 3 days in the gym where people are strengthening certain body parts and also functionally becoming stronger to get ready to return to work so that they don't re-injure themselves when they actually get back to their regular routines. Deep needling, just a picture of some of the apparatus that we use for deep needling or acupuncture, which can be part of people's treatments if required and if the person wants to have that done. I do quite a lot of deep needling, not a lot of acupuncture. I find deep needling actually works much better than acupuncture does. Tele-rehab is still available at the clinic. Occasionally we use it. Sometimes people have moved away, but they still want to stay in contact, or if somebody's sick but would still like their appointment, they'll use tele-rehab. Certainly not what it was during COVID, but it is still definitely available and can work very well. Coverage, so payments come in many different forms. We are lucky in this area that we do have a partnership with the Family Health Team for those clients that don't have any insurance. And bundled care is also available after knees, hips, and shoulder replacements. So that also helps people post-surgery. We work alongside the healthcare team in Goderich, and that's a real positive of a small town, is getting to know the other healthcare providers that are around. So we have the Alexander and Marine General Hospital close by, and then the Maitland Valley Health Team. So we're very lucky to have a great team of professionals in the area to work with, and basically to talk to and utilize as needed. We also try to work with the other healthcare providers in the area as well. Goderich, as you know, is a small community, and there's a beautiful picture of our lovely square. Working in a small town is nice, and I really enjoy it because you do get to see different family members, and over time you see families change and grow. And as we all age, it's a privilege to get to know and see these people. We try to give back as much as possible. We have some really great organizations in town, certainly in the healthcare field. So the hospice and Gateway and the Hospital Foundation and Rotary, et cetera, are all terrific places that we try to support as much as possible. And I think the really funny thing in a small town is that people can't get away with doing what they're not supposed to do if your physiotherapist has told you that, because I'll probably see you running on the beach when I'm on the beach if you're not supposed to be, or doing something that you're not supposed to, which is always very amusing when that happens. So thank you very much.
Okay, thank you, Dagny.